is identifying effective herd and cow selection criteria for selective dry cow therapy in Australian pasture-based dairy herds.
Thank you. So, as Peter said, I'm Lauren, and I'm going to be presenting some data that we've been looking at in southeastern Australia. So, just a little bit about the Australian dairy industry and the sort of farms that I work with. So, is this on work? Yep. Based down here in southeast Victoria in Gippsland, in one of the main dairy regions of Australia. Our dairy systems are pasture-based, so our cows are calving outside in the paddocks, which means they're exposed to the elements and at risk of mastitis, and particularly in winter or during that dry period when they're outside if they don't form an effective teat plug. So antibiotics are a fairly big topic at the moment, antimicrobial usage. So in the Australian dairy industry, as is in line with a lot of other places around the world, 85% of our antibiotics usage is for the prevention and treatment of mastitis, and 65% of those are used during the dry period. So as we just heard before, since the 70s, blanket dry cow therapy has been quite popular, and we're still sort of there for the vast majority of our herds in Australia. So the quarters of every cow have a long-acting antibiotic treatment infused into them at the end of the lactation to provide prevention and of new infections and to cure existing infections. So I guess with antimicrobial resistance becoming a growing threat and certainly something that we need to be concerned about, it's a preventative use of antibiotics where we have an opportunity to reduce our usage without impacting animal welfare or milk quality. So if we're looking at, if we're saying we need to not use the antibiotics for the preventative reasons, and we've got cows calving outside in all sorts of weather conditions, it's currently spring calving where I come from, and there's an awful lot of water and mud around. So we need something else to protect them if we're not going to use the antibiotics for that preventative. So that's where internal teat sealants come in. So Teat Seal is the trade name in Australia of the main brand that we have. It's a non-antibiotic sterile intramammary infusion, and essentially it's infused the same way as a dry cow antibiotic, and so it sits except it's not massaged up the udder, so it sits at the base of the teat canal and forms a physical barrier to prevent mastitis in the dry period and early post-calving period. So at the moment in Australia, its predominant use is for prevention of mastitis in heifers or to be administered concurrently with dry cow. So the antibiotics are infused and then followed up with the teat sealant. In a study done in Australia, in the Gippsland region actually, we saw that the addition of internal teat sealants to dry cow antibiotics cut the number of mastitis cases in early lactation by up to 70%. So we know it's really effective at preventing new cases of mastitis in the dry period. So with that in mind, we wanted to look at selective dry cow therapy in the Australian dairy industry, looking at a comparison between Teat Seal only and antibiotics and Teat Seal in low-risk dairy cows. So cows that are really at low risk of having an infection in their udder and therefore really just need that prevention of a new infection, not the cure of the existing infection. So there was selection criteria at both the herd and cow level. It was a clinical field trial. I had 11 herds enrolled in it, which worked out to be 1,480, that's meant to be 81 cows there. The herds had to have a bulk milk cell count of 250,000 cells per mil or less for the lactation. So in Australia, the 250,000 cells per mil is sort of the premium threshold for milk companies. So if your bulk tank cell count goes above that, then there's usually financial penalties. They were negative for strep, all the herds were negative for strep, agalactate and mycoplasma on a PCR bulk tank test. And they had to be herd testing, which not all of our herds do in Australia, and certainly not in our area. We've probably only got about 30% of our herds that actually perform herd testing. So they had to do at least 3 herd tests per lactation. So if the herd was, once the herd was enrolled in the study, the individual somatic cell counts of the cows were looked at. All of the cows that had a cell count of 150,000 cells per mil or less for the entire lactation, and no known history of clinical mastitis for that lactation, they were then enrolled just based on odds and even ear tags into an internal teat sealant group, or a group that was to receive dry cow therapy, which in this case we used 600 milligram cloxacillin and internal teat sealant. And then post-calving, we looked at the herd test records, clinical mastitis records, and reproductive performance. So just a little bit about the threshold. It was based on some studies done a while ago in Victoria, and then repeated more recently in New Zealand. And essentially, we chose 150,000 cells per mil, which is a reasonably conservative threshold to start with, in the hope that we weren't going to include too many cows in the study, I guess, that had a subclinically infected udder. So the sensitivity at 150,000 cells per mil of a cell count predicting an infected udder was 92. So the Dryoff was performed by farms and farm workers. So we wanted the results to be applicable, I guess, in the real world. So all farms of the 11 farms that were enrolled, and anyone that was going to be filling out any sort of paperwork, anyone that was going to be involved in the Dryoff process at all, underwent a training program. So it was just a simple program to make sure that they understood the importance of hygiene and the risk factors involved in poor Dryoff technique. And then I was at as many Dryoff mornings as I could be. Unfortunately, I couldn't make it to all of them, just depending on the days they were drying off. So we dried all of the cows off together. And so what we've started to look at, and we've got some preliminary results looking at the herd cell count data. So these are our, up on the y-axis here, you'll see individual somatic cell counts, and it's the average for each herd split into the Teat Seal and dry cow group. So the red bars are the Teat Seal only group, and the green bar is the Teat Seal and dry cow therapy group, and it's the average somatic cell count of each cow, of each group. And then down on the x-axis here we have the herds, so there's 11 herds. So just eyeballing it, they look reasonably similar. Those red bars do tend to look like they're a little bit higher in the majority of the farms. So we then looked at, we did some binary regression, essentially looking at all of our cows' individual cell counts. And if any cow had a cell count of above 150,000 cells per mil for the lactation, she was considered a yes, and if she had all of her cell counts below 150,000, she was considered a no. So of that, the Teat Seal only group, we had 35.47% with one cell count, or at least one cell count of above 150,000 cells per mil in the subsequent lactation. In the Teat Seal and dry cow only group, we only had 29.39%. So there's a p-value of 0.012. So we had a look at that, the premium milk threshold in Australia, the 250,000 cells per mil, and found that again the Teat Seal only group had a higher percentage of cows that had one or more cell counts of above 250,000 cells per mil in the lactation after the trial. With the p-value there is 0.02. So had a little bit of a look at the overall cell counts. And you can see the geometric mean of the Teat Seal only group is 111,000 cells per mil versus the Teat Seal and dry cow group of 96,000 cells per mil. So I guess the next step for us is to look at what does that mean? 96,000 cells per mil and 111,000 cells per mil from a financial point of view, purely based on cell counts, doesn't make a lot of difference in Australia. So we've got some interim cell count results which are quite interesting and not necessarily what was expected. So the next step is to look at the economic significance of these findings and have a look at how that does actually affect the real world, I guess. Clinical mastitis data was collected. However, because we only have just under 1,500 cows in the study and there's a very low incidence of clinical mastitis, we don't have enough power to do a lot with it. So we're in the process of having a look at reproductive data, reproductive performance in the subsequent lactation of the cows in each group, as well as the cull rates of the animals in each group to see if there's any difference in those and what we can sort of draw from that in conjunction with the economic significance of the individual cell count changes. So that is all.